Today, we're diving into something that affects so many of us, that is blood pressure. This video has 3 main chapters. Why checking blood pressure regularly is important. Why does it go up? How can you keep your blood pressure in check? There is no fancy jargon, just simple, straightforward discussion. Keeping an eye on blood pressure is crucial because high blood pressure, also known as hypertension, is a major risk factor for serious health issues. Here are 7 reasons why it's important. Number 1. High blood pressure puts extra strain on your heart, making it harder to pump blood. Over time, this can lead to heart disease, heart attacks, and heart failure. The heart has to pump against higher pressure, which can cause the heart muscles to thicken and stiffen, reducing its efficiency. Number 2. Hypertension is one of the leading causes of strokes. High blood pressure can cause arteries in the brain to burst or become blocked, leading to a stroke. A stroke can cause permanent brain damage or death. Number 3. Your kidneys filter waste from your blood. High blood pressure can damage the blood vessels in the kidneys, leading to kidney disease or even kidney failure. When the kidneys don't work well, harmful wastes build up in the body. Number 4. High blood pressure can damage the tiny blood vessels in your eyes, leading to vision problems or even blindness. This condition is known as hypertensive retinopathy, and it can cause vision loss if not managed properly. Number 5. High blood pressure can cause your blood vessels to weaken and bulge, forming an aneurysm. If an aneurysm ruptures, it can be life-threatening, leading to severe internal bleeding. Number 6. There's evidence that high blood pressure is linked to cognitive decline and dementia. The reduced blood flow caused by hypertension can damage brain cells and contribute to cognitive problems over time. Number 7. High blood pressure often doesn't have noticeable symptoms, which is why it's called the silent killer. Many people don't know they have it until they develop serious complications, like a heart attack or stroke. By regularly monitoring your blood pressure, you can catch potential problems early and take steps to manage your health. Simple lifestyle changes, medication, and regular checkups can keep your blood pressure in a healthy range, reducing your risk of serious health issues and improving your overall quality of life. Wait, there is more, but do not forget to hit the like button and subscribe, down below. So, let's start with this. What is blood pressure? It's the force of your blood pushing against the walls of your arteries. Imagine a garden hose. If you turn the water on full blast, the pressure inside the hose goes up. The same thing happens with your blood vessels. When the pressure gets too high, it can cause problems, big problems. Now, you might wonder why blood pressure tends to creep up, especially as we get older. A few things are going on here. First, our blood vessels get stiffer as we age. Think of an old, rubber band that's been stretched too many times. It doesn't snap back like it used to. That's what happens to your arteries. This stiffness makes it harder for your blood to flow, which increases pressure. Another reason is weight gain. It's no secret that as we get older, many of us put on a few extra pounds. But even a small weight gain can make your heart work harder. And when your heart works harder, blood pressure rises. According to research, for every 2 pounds or about 1 kilogram you gain, your blood pressure can go up by about 1 millimeter of mercury. It doesn't sound like much, but it adds up over time. Stress is another big factor. Life is full of stressors, and when you're stressed, your body releases hormones like adrenaline. These hormones increase your heart rate and tighten your blood vessels, making your blood pressure spike. It's like stepping on the gas in a car. The engine revs up, and so does your blood pressure. But it's not just stress. Your diet plays a huge role too. Eating too much salt is a common culprit. Salt makes your body hold onto water, and that extra fluid increases your blood pressure. It's like adding more water to that garden hose, pressure goes up. Now, let's talk about those numbers. When you measure blood pressure, you get 2 numbers, like 120/80. The first number is called systolic pressure. It's the pressure when your heart beats. The second number is diastolic pressure, which is the pressure when your heart rests between beats. So, if your reading is 120/80ths, the 120 is systolic, and the 80 is diastolic. But what do those numbers mean? A normal blood pressure reading is around 120/80ths or lower. If your systolic number is between 120 and 129, and your diastolic number is less than 80, you're in what's called elevated blood pressure. It's not high blood pressure yet, but it's getting close. When your systolic number hits 130 or higher, or your diastolic number is 80 or higher, that's high blood pressure. And here's the thing, high blood pressure doesn't usually cause symptoms. It's called the silent killer, because you might not feel any different, but inside, your body is under stress. Over time, high blood pressure can damage your arteries, which can lead to heart disease, stroke, and other serious issues. So, what can you do? How can you keep your blood pressure in check or lower it if it's already high? Research gives us some solid tips. First, cut back on salt. If you stop buying processed foods, you may have already reduced the salt intake. The American Heart Association recommends no more than 2,300 milligrams of sodium a day, but ideally, you should aim for 1,500 milligrams. That's about 3/4 of a teaspoon of salt. It doesn't sound like much, does it? But you'd be surprised how much salt is hidden in processed foods, like bread, pizza, and canned soups. Start reading labels, and you might be shocked. Next, eat more fruits and vegetables, low in carbohydrates and sugars. Most of them are rich in potassium, which helps balance out the effects of sodium. Avocados, bananas, oranges, and spinach are all great sources, but bananas are also too high in sugar. Think of potassium as the good guy who helps lower blood pressure by relaxing the walls of your blood vessels. Research shows that people who eat a diet rich in potassium have lower blood pressure. Wait, there is more, but do not forget to hit the like button and subscribe, down below. Another tip is to get moving. Regular exercise strengthens your heart. A stronger heart can pump blood with less effort, which lowers the pressure on your arteries. You don't have to run a marathon. Just 30 minutes of moderate exercise, like brisk walking, 5 days a week can make a big difference. Studies show that regular physical activity can lower blood pressure by about 5 to 8 millimeters Hg in people with high blood pressure. But what if you're not a fan of the gym? There are other ways to get moving. Gardening, walking, running, jogging, dancing, or even cleaning the house can get your heart rate up. The key is to find something you enjoy, so you'll stick with it. Then there's weight. Losing even a little weight can have a big impact on your blood pressure. According to research, for every 2 pounds you lose, you can lower your blood pressure by about 1 millimeter Hg. So, if you lose 10 pounds, that could bring your blood pressure down by 5 to 10 millimeters Hg. It might not seem like much, but remember, every little bit helps. Now, let's talk about alcohol. Drinking too much can raise your blood pressure. But the good news is, if you cut back, your blood pressure can drop. The American Heart Association suggests no more than 1 drink a day for women and 2 drinks a day for men. If you're not sure what that looks like, it's about 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of hard liquor. One more thing to consider is stress. We can't always avoid stress, but we can change how we deal with it. Deep breathing, meditation, or even taking a few minutes to sit quietly can help. When you're stressed, your body releases hormones that raise your blood pressure. But when you relax, those hormone levels go down, and so does your blood pressure. Research shows that relaxation techniques can lower blood pressure by up to 5 millimeters Hg. Smoking is another factor. If you smoke, now's the time to quit. Smoking raises your blood pressure, but the benefits of quitting start almost immediately. Within 20 minutes of quitting, your heart rate and blood pressure drop. Within a year, your risk of heart disease is cut in half. Quitting isn't easy, but it's one of the best things you can do for your heart and blood pressure. Finally, let's talk about medication. Sometimes lifestyle changes aren't enough, and that's okay. There are plenty of medications that can help lower blood pressure. But they work best when you combine them with a healthy lifestyle. If your doctor prescribes medication, take it as directed. Don't skip doses, and don't stop taking it without talking to your doctor. High blood pressure is a serious condition, but it's also something you can control. So, what's the takeaway? Blood pressure can creep up for a lot of reasons: age, weight, stress, diet. But there's a lot you can do to keep it in check. Cut back on salt, eat more fruits and veggies, get moving, lose a little weight, drink less alcohol, manage stress, quit smoking, and if needed, take your medication. Remember, it's never too late to start taking care of your blood pressure. Small changes can add up to big results. Your heart will thank you for it. Thanks for watching, and take care. Disclaimer: consult your healthcare professional before changing your medication or lifestyle. None of the information provided by this video is a replacement for your physician's advice.